Hey everybody, it's Dr. Brace here. For today's Facial Plastics Friday, I wanted to continue our discussion on lower eyelid surgery. So I'm going to show a video here of a lower eyelid transcutaneous or skin muscle flap lower lid blepharoplasty. Last week we showed a transconjunctival approach where we went through the inside of the eyelid. So in this video that I'm going to show here, you'll see me making an incision just underneath the eyelashes, lifting the skin off of the muscle, and then using sutures to pull the muscle up to tighten it and then trimming away the extra skin. So why would I do that? Well, with the lower eyelid, as I mentioned last week, you have to be very, very delicate and you have to be very conscious of lower eyelid malposition. A skin muscle flap or a transcutaneous approach would be something I would reserve for someone that has folds of muscle and folds of skin that aren't going to go away through a transconjunctival approach. If there's a little bit of extra skin, we can laser that with a CO2 laser and tighten the eyelids. If there's maybe 3 millimeters, 4 millimeters of skin, we can do a skin pinch where you just gather the skin up and snip that away and sew it up. But when you have folds of eyelid skin and folds of muscle, there's no way to tighten up that eyelid other than making this incision, pulling everything tight. Now you'll see me in the video lifting the skin up, showing the muscle and the suture suspension, or the suspension sutures in the muscle, how we tighten the eyelid. But you also see me have the patient open their eyes, look up, and open their mouth. And that pulls the eyelid down and puts it on stretch. And when we trim the skin for the lower eyelid surgery with a skin muscle flap, that's what we do. We put everything on a stretch and we trim it so that there's excess and there's redundancy. And even then, I usually cut the skin slightly above the incision line so that there is extra, because what we really don't want is for someone to end up with an ectropion or an eyelid pulled down like this, which is the feared complication of this surgery. So for all the residents out there, all the trainees, lower eyelids, my approach, chemical peel or CO2 laser if there's less than 3 millimeters of excess skin, skin pinch if you have dermatochalasis or extra skin, but it's only about 4 millimeters, 5 millimeters maybe, and you can safely pinch that without disturbing the eyelash position. If it's an issue of fat and puffiness and hollowing, but not really extra skin, we're going to go transconjunctival and address it that way. And if we have folds of skin, folds of muscle, we would address that through a skin muscle flap. So for those that are squeamish, here comes the surgical videos. Otherwise, everyone have a great day. Bye-bye. All right, so we have our lovely patient here today. We've just done an upper lid blepharoplasty. I've left the outer aspect of the incision open because we're about to do the lower eyelids, a skin muscle flap, and I'm going to use this to access the canthal tendon to suspend the eyelid so that we don't get a lower lid malposition. I also did something called a blepharoplasty brow lift, where I've pexied the eyebrow to the bone here because her eyebrows were pretty heavy and were falling on her eyelids, and so there's some suture underneath here, sewing the eyelid down in position on the brow, and it will scar in place there. And so we've done upper eyelid blepharoplasty, blepharoplasty, brow pexy, and we're about to do a skin muscle flap. Okay, so we have the lower eyelid suspended here. Here are the lower eyelid lashes. It's suspended to close the eye and protect it. I've lifted the skin. So this is the skin flap, and I've lifted it all the way down to the bone. The muscle is underneath here, and I've made a little cut in the muscle out here. And what we're gonna do is pull the muscle up and attach it to the bone of the orbit. And you can see what that does to the eyelid, where she has some hollowing here and some folds of skin. The muscle, it's going to come up, the skin's going to follow, and you can see how smooth her eyelid's going to be afterwards. Sorry. Yeah. So, again, the eyelid is sitting like this at rest. When we grab the muscle and tack it up to the bone, trim away the excess skin, you can see how that will smooth everything out. So this is a skin muscle flap. Skin, muscle, and we're using the muscle to suspend the eyelid up and smooth out the eyelid.
Anytime.
Okay, so we've lifted up the skin off of the muscle. I've placed my 2 suspension sutures, one in the orbicularis, one in the tarsal plate, so the eyelid is actually quite taut. We've closed the upper blepharoplasty incision to this point so we can place those suspension sutures, and now we're going to trim the skin. So this is the skin. Now we're going to overlap it, you can see how much excess there is. It's a mistake to just cut right there because it will fall down and then she'll have an ectropion. So what we do is we'll get her to open her mouth and look up, and we'll kind of put everything on a stretch, and then I'm going to push it down, and you can see that basically nothing has to come out immediately, but a lot of the excess here is lateral, and so I'm going to use scissors. Just do a very conservative excision. One mentor of mine once told me, if you're taking more than 3 millimeters of skin from a lower eyelid, think twice, and that's good advice. So we usually take about 3 millimeters. And then the rest of it, if it has to be tightened, can be tightened with a laser or a chemical peel. You can close your mouth now. As you can see, when she comes to rest, there's a little bit of redundancy here. And open your mouth again, and look up. And when she looks up, it opens just a tiny bit there, but there's excess, so this should heal perfectly. And then close your mouth. Yeah, and so you can see then it comes to rest. So there's a little redundancy, and that's what we want. We don't want this so tight that she pulls her eyelid open at rest.